Good day. I am Dr. Luis Abola, and I am one of the nominees for the Board of Regents for the Philippine College of Physicians. We've been asked to answer several questions, and here are my responses to the questions. In terms of the Philippine medical education, we all know that the Philippine medical education is now in a crisis, especially now because of the COVID-19 pandemic. Our students have not been able to do face-to-face meetings, and more importantly, have not been able to, to see patients, no? to have hands-on experience with the patients, and this has to be addressed. Um, because these will be the future doctors who will be taking care of us. So we have to come up with innovations in learning. We have to think out of the box to find how can we really teach our students now in this day and age with all of the limitations that we have. Secondly, we have to address, as I see it, no, some students or even their parents are so concerned with grades. And that is why there's still some cheating in schools. Probably we can think of a system wherein the grades are not seen by the students, but they just receive a pass or fail rating during their time in school, even the board exams. But although I see now that we only have pass or fail. Then I think we all should also focus on ethics and how should we deal with our patients, how should we relate to our co-physicians, and also how do we relate with the pharmaceutical industry. And then we should also teach our students the new technology, how to utilize or maximize the technology available now for learning, for acquiring knowledge, for acquiring new data. For the second question on universal health care, first, the government has to make sure that the project or the universal health care is sustainable. That means there are funds and sources of funds for the universal health care. That's very good objectives. Secondly, probably it should be implemented in stages to manage expectations and um, to straighten out some kinks that may be present. Probably start in far-flung areas or in areas where where there's poor healthcare delivery. And secondly, I think the government should also invest in IT infrastructure, because that is very important in monitoring our patient care, our patients, and you can easily transfer their files if they go to another physician. And then that can also be a way of assessing the the activity or the activity of the physician in charge of that community. We should probably think of coming up like the British system for national health health institute or national healthcare system, wherein there is a body that supervises all of the GPs in the country. Lastly, for the COVID, we are now in the second surge or third surge, if you may want it, and we still have a lot of cases, almost 200,000 active cases. What should we do? I think, first of all, I think the government should really invest also again in IT infrastructure so that everything is connected and it's easily analyzable from the laboratories to the hospitals, so that we have real-time data numbers that we can tell our people. Secondly, is I think the contact tracing should be rationalized. Each LGU has its own tracing system, I think, and that puts a lot of trouble because all of these tracing platforms cannot interface with each other. So there should be one tracing platform so that we can easily do contact tracing. That means also we should identify and isolate the cases. And that means also the infrastructure for isolation. Third would be, of course, the health and well-being of the healthcare workers. Incentivize them, make sure that they are well taken care of, not only in terms of compensation, in their well-being, but also their mental well-being. I think is very important because there's a lot of um, depression, anxiety during day and age. And of course, lastly is vaccination. There should be transparency in the vaccination, and there should be some order in the way vaccinations are done because, again, LGUs seem to have their own system, and one system is better than the other, one's also chaotic. So vaccination is still a very important aspect so that we can take control um, of this pandemic. Thank you very much.